Vaccination is a way of preventing diseases, and when these diseases are not presented, we are forced to treat the animals. And some of the treatments do not work because they target to alleviate the symptoms, but not treat the diseases. So if you look at like a case in poultry, a disease like Gumboro causes a suppression in immunity, and if the chicken are not properly vaccinated, either at the parent stock level or at the farm level, their immunity get compromised. So then they succumb to a lot of infections, which lead to a lot of antibiotic usage, which would hitherto not be needed if a proper vaccination routine was put in place. If you look at the case of goats, a disease like contagious caprine pleuropneumonia, commonly known as CCPP, is very difficult to treat because it's a bacterial infection that goes and affects the lungs, and a lot of drug regimes will be used over a long period of time, which may allow this bacteria to get used to the kind of antibiotics being used. They lead to drug resistance. And because of the inadequacy of our animal health delivery system, then we may end up with farmers self-prescribing before getting to know the real problems they are dealing with. So vaccination is a good way of ensuring that only diseases which are not preventable by proper management have to come to the fore for treatment. So a good farm will succeed if it is grounded on management. Any farm which is grounded on interventions of treating problems which are very recent normally end up in failures. So for a good farm, a farmer needs to get in the good management practices like hygiene, proper housing, proper feeding, and then vaccination. If farmers vaccinate their stock, they have a security of their livestock because they are assured that the animals will not die of preventable causes. This allows them to focus more on improving their herds for better productivity. A case in point is ECF. We've been doing a lot of ECF vaccination at SIDAI since 2012. To date, we've done 44,000 vaccinations, and the farmers with whom we started the vaccinations in 2012 are still doing the vaccination to date. And what has happened to them, it has given them kind of insurance that their animals will not die of this preventable tick-borne disease, which has been killing so many of the important livestock that we keep. So when we get East Coast fever outbreak, we have to treat these animals. And the treatment involves use of very strong anti-protozoal drugs, which would otherwise be preserved if the animals are vaccinated. And besides that, we also allow the farmers the confidence to now invest in a herd health program, because without them having the security that their animals will be safe, then they tend to be averse to adopting some of the control practices, as they are not sure whether the animals will be living enough to be sold to help them recover their investment.